Introduction. Learning to control one's body may help individuals to overcome certain conditions. To give patients more information about their body processes, medical professionals can use biofeedback. The research on biofeedback interventions produces different results due to the nature of this procedure. It is important to understand the relationship between behavior and neuroscience. Biofeedback and its types, including neurofeedback or EEG biofeedback, can be considered examples of this relationship at work. This paper aims to define biofeedback and explore its types, purposes, advantages, and disadvantages, as well as some ethical considerations. Definition. According to Schwartz and Andrasik, in the beginning, there were many descriptions of biofeedback that highlighted different parts of the process. However, biofeedback can be explained as a procedure that uses certain instruments to help an individual learn more about his or her physiological activity and influence it by implementing acquired knowledge. Devices that are required to perform the intervention may include an electroencephalograph, EEG, electromyography, EMG, feedback thermometer, and others. Every instrument has several purposes. First of all, these tools monitor a particular physiological process. Then, these instruments measure the monitored data. Finally, the results of the measuring process are displayed in a way that a patient can understand. Therefore, the choice of used instruments depends on the type of intervention. For example, some devices measure heart rate, blood pressure, or skin temperature. Neurofeedback is a type of biofeedback that revolves around brain activity. While biofeedback can work with other functions of the body, neurofeedback involves measuring and assessing brain waves. Furthermore, EEG biofeedback is the most common type of neurofeedback, which uses an electroencephalograph for its procedures. This kind of intervention is mostly used for diseases and pain that are connected to brain functions. Usage. Biofeedback intervention can be implemented by mental health professionals, namely psychologists, therapists, and counselors, as well as clinical social workers and trained nurses. For example, some studies explore the effect of biofeedback intervention on individuals with stress, anxiety, and depression. According to the study by Ratanasiripong et al., students with high levels of emotional distress that underwent biofeedback therapy reported to having fewer symptoms than students that did not participate in the intervention. The authors note that post-intervention scores show that biofeedback significantly impacts participants' mental health. Other issues that can use biofeedback include various musculoskeletal issues, urinary and fecal incontinence, and different types of pain such as chronic pain, muscle pain, and tension pain. Neurofeedback can be used to treat migraines, headaches, addictions, insomnia, and other problems. The use of neurotherapy is often connected to the treatment of children. For instance, many studies investigate the effects of neurofeedback on children with ADHD. One study by Micoulaud-Franchi et al. Looks at the EEG neurofeedback treatment of ADHD in children, concluding that this type of therapy is especially useful in the treatment of inattention of patients with ADHD. However, other complications connected to this disorder are affected as well. The authors say that EEG biofeedback significantly reduces their impulsivity and hyperactivity. The use of biofeedback shows that scholars should devote more attention to understanding the ways one's nervous system works. If doctors learn more about this system, they will be able to advance biofeedback programs that are currently changing people's behavioral patterns. For example, the treatment of chronic pain currently relies on a patient's self-assessment, which is used in neurofeedback. By creating new forms of biofeedback therapy, medical professionals may help patients who suffer from diseases that do not have a cure. Pros, cons, and ethical considerations. Biofeedback interventions are easy to perform as they involve a patient using certain equipment to reflect on his or her physiological processes. This treatment is often followed by such operations as deep breathing, establishing a positive cognition, and participating in self-reflection. Thus, biofeedback may not involve any medication or expensive equipment. Furthermore, some devices for biofeedback are highly portable, which allows patients to perform the treatment at home. Furthermore, according to research, biofeedback interventions have long-term effects on cognition and behavior. The therapy is also non-invasive and empowering in some ways, as patients have to rely on their abilities to complete the treatment. One of the main drawbacks of this treatment is the lack of definitive proof of its efficiency. While many studies report positive outcomes for biofeedback, the non-invasive nature of the interventions does not allow scientists to find concrete data on the results of treatment. Furthermore, some critics note that instruments that are used during treatment may be rather expensive. Biofeedback focuses on people's ability to change their cognition through monitored behavior and positive thinking. However, the limitations of these processes should be taken into account. The specialists that use biofeedback should remember that not every person can adequately interpret the information from biofeedback. Thus, ethical considerations should include people with serious mental illnesses that affect one's cognition. Other considerations are not severe. Biofeedback is non-intrusive and does not require patients to take any dangerous medication. Most instruments are not complicated or intrusive in any way. Point of view. I did not have any experience using EEG biofeedback. However, I think that such situations can occur. The study by Ratanasiripong et al. Explores the effect of biofeedback on students with high levels of anxiety and depression. I would consider using EEG biofeedback to alleviate stress. In my opinion, not every person should view biofeedback as a helpful tool. Its efficiency largely depends on an individual's ability to control his or her cognition. However, some people may benefit from using biofeedback. Study Corgi can help you make your studies smarter. Visit studycorgi.com for more samples like this, study tips, and writing tools.